We all know that oxygen is what keeps us alive. Oxygen travels through our bloodstream and reaches all parts of our body, including the brain. A stroke is when the pathway of blood to our brain is blocked, and therefore that area of the brain does not receive any oxygen. The tissue that is not receiving any oxygen must be treated quickly, or the brain tissue will die and the symptoms may become permanent.
The residual effects of stroke have life-altering complications for stroke survivors and their families. In this video, we will be discussing the importance of collaborative care and how to create a safe environment at home for those recovering from stroke.
Throughout your stroke recovery process, you will encounter many different members of the healthcare team. For the purpose of the video, we will be explaining the basic roles of physiotherapists, occupational therapists, speech pathologists, and psychiatrists. All these occupations work together to create a plan of care for your recovery. They are here to help you regain as much independence as possible.
It is important that you set realistic goals with your healthcare team. If the goals are too difficult, it may be hard to stay motivated and present throughout your recovery. For example, a realistic goal may be to walk with a two-wheel walker and not go back to running marathons right away. Depending on the type of stroke you have and the amount of brain cells that are affected, your symptoms will vary greatly. In this video, we will discuss common issues that affect stroke survivors such as mobility, activities of daily living, which we will be referring to as ADLs, swallowing, communication, mental health, and using the washroom.
After a stroke, some may enter a care home where they can be offered assistance in activities of daily living. Those who have more independence and have a good support system can return home. It is important to ensure that the home is a safe environment in which stroke rehabilitation and independence can be maximized. This will allow you to best orientate yourself back into your community and home environment. If it is possible, there are many benefits to returning home after a stroke. For many of us, we feel very connected to our homes. Therefore, when we return, we can regain a part of our identity, which can help us return to our normal self.
It is important to keep in mind that many stroke survivors will need long-term assistance to complete their activities of daily living. Depending on which part of the brain was affected during the stroke, will determine what kind of challenges you will face during recovery. You may have physical difficulties such as paralysis of one side of the body, you experience difficulties reaching for and handling objects, or need extra help with feeding, washing, and moving around your home. Therefore, it is important to discuss solutions that can be used to help you recover in a safe and positive way.
Independent ambulation can be a major long-term goal during the rehabilitation phase of stroke. Although this is an excellent goal, we must be mindful of safety precautions. According to the literature, 40% of all stroke survivors suffer serious falls within a year after their stroke. This is due to the fact that following a stroke, the brain tissue controlling the muscle movement may be damaged. This can lead to weakness or paralysis of the affected side. A physical therapist aids stroke survivors in regaining mobility. They will start slowly with range of motion exercises and dangling on the edge of the bed. If applicable, physiotherapists will equip you with proper equipment such as wheelchairs, walkers, or canes and teach you how to use them.
A physiotherapist will help you during your recovery process in order to help you regain your strength after a stroke. They use resistive training, strength training, and range of motion. For our first purposes, we will display range of motion first. Marie, do you mind using your arms in a circular motion? Perfect. And once she's good at that, we will try resistive training. So what you're going to do is put it under your feet and practice like this. Perfect. Strength training can also be very beneficial. So use the weights, and you can do the same thing. There you go. There are a few exercises to try in order to regain your strength after a stroke.
Following a stroke, you may have a slower walking speed or difficulties coordinating your steps. It is important to take your time at crosswalks, stay close to washrooms, and ask your family members and friends for help or to slow down. Another useful tip is to minimize the distractions around you in order to stay focused, maintain balance, and reduce your risk of falls.
There are a few key points you will want to keep in mind when ensuring your home is a safe place for you to return. You will want to ask a friend or family member to prepare your home before you are discharged from the hospital. Preparation work includes decluttering walkways, installing safety equipment, moving important items to places you can access them, and finding a way to manage any stairs in your home.
That's it.
If it is needed, ensure you have the proper assistive devices to ensure you can mobilize around your home and perform ADLs safely. These are devices such as wheelchairs, canes, raised toilet seats, and mobility ramps. They are found to facilitate the rehabilitation process and potentially prevent inactivity and feelings of isolation. Handrails have been proven to be beneficial in encouraging mobility and participation in home activities. Furthermore, consider putting in place slip-resistant floor surfaces and moving furniture that obstructs pathways.
Another thing to consider is the height of things in your home. For example, objects may need to be moved onto the counter for easy access, or the height of your bed may also need to be adjusted to reduce your risk of falling.
It is important to move any necessary out-of-reach objects within reach.
Open layout and single-story homes are the most supportive for stroke rehabilitation. Especially if you are using a wheelchair to assist with mobility, stairs and tight spaces can be a large barrier. Because strokes can affect your mobility, cognition, and spatial awareness, it can be very difficult to take care of yourself following a stroke. Activities such as dressing yourself, brushing your teeth, or cooking food can suddenly become big tasks that are difficult to accomplish.
Occupational therapists specialize in helping stroke survivors relearn activities of daily living to regain independence. They guide you through steps of routine tasks such as brushing your teeth and getting dressed for the day. However, you may need help from family members or home care aide to take care of yourself upon discharge.
Fine motor tasks such as applying toothpaste to a toothbrush might be difficult for some stroke patients. A little extra assistance can go a long ways. Now, as a nurse, I can make sure they have all of the affected areas, as some stroke patients may lose their sensitivity in one area. As a caregiver, they may need a little extra help.
Following your stroke, the muscles involved in swallowing may be damaged. Sometimes you will no longer have a gag or cough reflex, which can lead to choking and pneumonia. The first time you eat, you may be monitored by a nurse or a speech pathologist. This is called a swallowing assessment, which is done to see if you have adequate function of your tongue and jaw and that you can eat safely.
Many stroke survivors are prescribed a diet of soft or pureed foods. This is common and may be permanent or temporary. Continuous swallowing assessments will be performed to monitor your progress. At home, you may need to adjust the foods you eat to follow your prescribed diet. It is important that your family is aware of these new restrictions.
During the recovery phase of stroke, you will be prescribed a diet depending on your ability to chew and swallow after your stroke. We have some examples here of different types of foods and how they can be prepared. As you see, this is a normal sliced apple. This is an example of a minced diet. And here we have a puree. Now, because Marie is having trouble swallowing due to her stroke, she's going to be prescribed the puree diet. And this will decrease her chances of aspiration.
If you have cognitive impairments, you may have memory deficits and difficulties learning new information. Other cognitive injuries can lead to difficulties with speaking and understanding language, which impacts your ability to communicate with others.
For some survivors, it is difficult to speak because they are unable to move muscles required. For others, they are unable to understand what others are saying to them. It is very important to establish good communication with the healthcare team. This will look different for every patient. No matter what you may need, your healthcare team is here to support you.
At home, it is helpful if your family is educated on the best way to communicate with you, whether that is writing on a whiteboard, communicating with images, speaking slowly, or asking yes or no questions.
A whiteboard can be a useful tool for patients who have little to no cognitive deficits but have troubles communicating verbally. Using images can also be a helpful way to communicate with post-stroke patients. It can also be helpful to ask yes or no questions in order to clarify the patient's needs. Would you like milk? Would you like water?
Depression is a common complication after stroke and affects roughly 1/3 of survivors. Depression can negatively impact your participation levels during rehabilitation. A psychiatrist may be a part of your stroke team. They can help you work through changes in self-identity, such as redefining your role as a parent, partner, and employee. They may also give you medication to help treat your mental health.
Another important aspect of creating a safe environment is to nourish your mental health. At home, it is important to believe in your own abilities and strengths. To regain your sense of identity or help build a new one, memories in the home such as pictures and books offer great emotional support and help facilitate participation in activities.
It is important for families to remind their loved ones of the goals which they have accomplished during the recovery process and be able to identify the symptoms of depression, such as withdrawing from activities, change in sleep patterns, and/or a change in appetite.
Following a stroke, survivors may have problems controlling their bowels. Your bladder muscle may be weak, or you may be unable to feel the urge to go to the bathroom. In the hospital, you may be put on a toileting schedule by the nurse. This is to promote the development of bladder muscles. With time, issues of incontinence are usually resolved.
At home, it is important to have a clear pathway to the bathroom. You may consider installing raised toilet seats to ease movement on and off the toilet. Furthermore, it may be helpful to install handrails within the bathroom to prevent falls.
There are many resources in Kamloops to help you in your recovery. In hospital, contact your physiotherapist or occupational therapist for information on equipment. Once you are discharged home, equipment can be purchased at many pharmacies or can be rented from Red Cross. There's also a Kamloops Stroke Recovery Branch. Their program includes exercise, activity, and emotional support. For family members caring for stroke survivors, Ponderosa offers a respite program to give caregivers a break. This in turn reduces stress and promotes continued support for stroke survivors.
Patients who have had a previous stroke are at high risk for having another stroke. It is important to understand the acronym FAST so that you or family members can help someone who's having a stroke. So you're going to start off by asking a few questions and then decide if you have to call 911. So the first letter of the acronym FAST is F. It stands for face. So you're going to ask the person to smile. Can you smile for me? And you're going to check for any signs of droopiness of the eyelid or of the lip, because that's a sign of a stroke. Next letter is A, so that's arms. Can you raise both arms for me, please? So that's perfect. You want to see that both arms are both going up at the same degree and that one isn't wavering or slightly lower than the other. The third letter is S, speech. Come up with a sentence and ask them to repeat it back to you. Do you like to eat breakfast?
Do you like to eat breakfast?
Perfect. So you want to see if there's any slurring or if she confused any words, got the order wrong, anything like that. So if she had those three things wrong or even one of the three, then it's now time to call 911. If you have any questions or would like any parts of this video clarified, call 811. It's the nurse's hotline number and they are available 24/7 to answer any of your questions that you may have throughout your recovery.